NDP leadership hopeful Adrian Dix brought his campaign to Vancouver Island today. He was not taking aim at his New Democrat leadership rivals, but at Premier-designate Christy Clark. The issue is health care, more specifically Clark's plans to link health spending to BC's rate of economic growth. That is a move, Dix says, that will see millions of dollars in health care funding slashed. But is that really the case? Our Shachi Curl has the story.
The plan makes no sense. It's without content and would damage our healthcare system.
One campaign down, one to go. As the Liberals focus this week on building the new leader up, NDP leadership hopefuls are working on taking her down over the Premier-designate's ideas around health care.
What I've said is we should move the spending on healthcare, the rate of spending on healthcare, toward the rate of economic growth in the province.
Those comments coming from Christy Clark a week before her big win. At the time, Liberal leadership rival George Abbott, a longtime health minister, slammed the plan.
I don't think that Christy or anyone should be creating illusions about what we can do in healthcare.
The Liberals may now be uniting behind Clark, but they've left some great ammo for the opposition to fire.
We're talking about a $518 million cut this year. That amount of money is about half the money spent on acute care, on hospitals on Vancouver Island. It would be a massive cut.
Christy Clark wasn't available for comment today, but her communications team says tying health spending to economic growth won't necessarily lead to cuts if the economy tanks. They say it would be more of a guideline than a hard line.
But Adrian Dix's criticism comes as he rolls out his own plans for health care as a would-be NDP leader. Among them, staffing clinics with nurse practitioners, lowering the costs of prescription drugs, screening British Columbians for colorectal cancer, improving health cleaning audits, and doing more diagnostic and MRI tests. But considering the Liberals spent nearly $150 billion on healthcare over the last decade, where does Dix propose to find the extra cash?
Why are we paying 40% more for generic drugs than in Ontario? We can do something about that. So I've made specific proposals, not just to make public health care better, but to do it in a more cost-efficient way.
Healthcare is a big expense in BC, and it's only going to get more costly in the decades to come. And this issue is going to see both sides wielding their scalpels against one another. In Victoria, Shachi Curl, A News.